My dear friends, the members of the APS Forum, how much I'm sorry that we cannot meet each other and hug each other like we did all the times which we joined the forum. This time it takes place in a beautiful place that again Ludmila is responsible for organizing it. I've been there several times and in it, we miss it. And let's hope that at least in our meeting of autoimmunity, the 12th International Congress, which will take place on the 28th of May, we still will have our virtual lectures, more than 300 lectures, and still you can submit abstracts. But next year, at the same time, we'll be able to hug, to have dinner together in Athens, the capital of Greece. My role in the next 3 hours of my talks is to convince you that the COVID-19 is a virus of autoimmunity. It's not less notorious than the EB virus, the Epstein-Barr virus. But also we will discuss how it is related to antiphospholipid syndrome. So let's start with our book that was published 30 years ago on the mosaic of autoimmunity, the factors that were associated with autoimmune disease, which we believed that we understand it very well. And in those days, we have classified the different factors which are involved in autoimmunity to the genetics, which is very important. Also, some immune deficiency, which are associated with autoimmune diseases like IgA deficiency. Needless to say, the hormonal, but it's not only the estrogen and the childbearing ages of 83% of all autoimmune disease, but also, for instance, prolactin, which is increased almost in all autoimmune disease. And last but not least is the environmental factors which are instrumental in triggering the autoimmune disease and deciding when the autoimmune disease will emerge and become overt. So schematically, which was drawn by Professor Noel Rose, the late Noel Rose, the father of the modern autoimmunity, is depicted here as environmental factor and basically infectious agents. And that indicates the book that we have edited together, Infection and Autoimmunity. Still, the genetic predisposition is instrumental, the endocrine, and then eventually the autoimmune diseases. Professor Noel Rose died at the age of 96, but I had the chance still to lose to him in tennis in the olden days. So the question is, what does it mean, genetics? Genetics means genes and also genetic markers. And for instance, one of the genes which is known to be notorious is PTPN22, which is associated with more than 25 or 30 different autoimmune diseases. But one of the HLA marker, the HLA-DRB1 haplotypes, seem to be indeed notorious. And we have published this paper in the olden days about the polymorphism of HLA-DRB1 in autoimmunity and mentioned that it is notorious. And this is just one table out of 3 published in our paper, indicating that the HLA-DRB1 haplotype prevails in almost any autoimmune disease, from lupus to Sjögren, from myasthenia gravis to pemphigus vulgaris. So the question is, what is there in the HLA-DRB1 haplotype carriers which make them to be predisposed to autoimmune disease? And the answer came from a paper in an unknown journal called Nature Genetics, which showed that those who carry the HLA-DRB1 haplotype, they have a better, aggressive, efficient immune system, and therefore it can protect them against different infections, viruses and bacteria, but at the same time make them to be more prone to develop autoimmune disease if additional substance from the environment or from inside will stimulate more the immune system. 30 years after, together with Carlo Pericone, we published the new version of our book, which is over 500 pages, and we became a little bit more knowledgeable about the causes of the mosaic of autoimmunity. And it is depicted here schematically. There is genetic, it's HLA-DRB1 or PTPN22, which indicates an hyperactive immune system. We need the hyperstimulation. The hyperstimulation can come from the infections like EB virus. It can come from the estrogen and prolactin of the women at the childbearing ages. But there are additional factors which I will use them currently to show you a proof of concept that this scheme is correct, and the combination of genetic with hyperstimulation leads to different autoantibodies as well as autoreactive T cells, autoimmune diseases, and it continues for a long time. It can lead even to lymphoma like we see in Sjögren syndrome. So one of the proofs is checkpoint inhibitor. The checkpoint inhibitor therapy for cancer were suggested by Alison Onjo, who were given the Nobel Prize in 2019. They assumed that we cannot overcome some autoimmune diseases because the immune system is blocked, is actually inhibited. And this came from the idea that following the action of the immune system, molecules like CTLA4 or PDL1 are entering into breaks by other molecules, and therefore the immune system stops to react. And they came with the idea, if we can unleash these breaks by antibodies, monoclonal antibodies, or small molecules, we will be able to activate the immune system, to give it to be more aggressive, and we will be able to overcome many tumors that we were not able to overcome them before. And indeed, this idea became practical, and more than 25% of uncurable cancers now can be cured and eradicated by checkpoints inhibitors. However, we are putting the body into an hyperstimulated condition, and the toll is actually a panoply of different autoimmune diseases, from brain encephalitis to skin diseases, autoimmune one, to colitis and to reactive arthritis and uveitis. So this is a proof of concept that if you unleash the immune system and you let it to be aggressive, you will induce autoimmune disease. But the question is, who among those who are treated with checkpoints inhibitors develop the autoimmune disease? So not surprisingly, in another paper, it has been shown that these are the carrier of HLA-DRB1 haplotype, to show again that you need the concert between the genetic and the environmental immune overstimulation. So if we will go to the scheme, we have genetic, the HLA-DRB1, the PTPN, the hyperstimulation come by the therapy of the checkpoints with molecules or small or antibodies. We unleash the brakes, we lead to hyperstimulation, autoantibodies, and autoimmune disease. The second proof of concepts come from external stimulation of the immune system that is put inside into our body, and these are the breast silicone implants, as you can see. The silicone implants were selected because of their consistency, but also because it was believed mistakenly or by knowledge that they are inert to the immune system, namely they do not respond to the immune system. However, meeting more than 300 women with silicone implants, we were able to find a very prevalent complaints of cognitive impairment, memory loss, severe chronic fatigue, pains, paresthesia, and even loss of hearing. And therefore, we were able to generate and to institute the syndrome which combines all these situations where we have an adjuvant effect from the environment, namely that we have something that stimulates the immune system. Adjuvants come from the Latin word adjuvare, to help. And we put the major criteria, minor criteria, and you can see that the widespread pain and the chronic fatigue and some of the neurological manifestation, including cognitive impairment and memory loss, are very prominent in those carrying this syndrome. And we have referred already also to the HLA. So the ASIA syndrome is a new syndrome, a new complex of how we develop autoimmune diseases, which means pre-autoimmune disease. I would call it undefined connective tissue disease or unclassified. And you can see the prominent issue, the chronic fatigue and the nervous system. It is not surprising that immediately after the silicone implants were started, many papers reported on different autoimmune diseases, specifically scleroderma, but also other. This is only one paper of 100 symptomatic women with breast implant, and you can see the lengths that this foreign substance remain in the body of the women, stimulating and bleeding out of the capsule. And you can see the symptoms, which include weakness and fatigability, widespread pain, arthralgia, but also indication of the hyperstimulation of the immune system with high levels of immunoglobulin. So it's not surprising when we have done a big data study on 25,000 women with silicone breast implant compared to 100 control match for age and sex, having all these clinical manifestation and published in International Journal of Epidemiology over impact factor 10, we're able to find out that all autoimmune disease that we measured, from multiple sclerosis to Sjögren and so forth, were more prevalent among the silicone implantee in comparison to the controls. So who among the 14 million silicone implanted women may develop the autoimmune disease? And as you can see in several papers, it has been noted that these are haplotypes of the HLA-DRB1. Again, indicating that you need the genetic and you need the chronic stimulation of the immune system. Here we see a table that we published separately about the different HLA which prevails in those who develop the different manifestation, autoimmune manifestation, ASIA manifestation in the silicone implant. And now we move to the COVID-19. A classical car, as you can see here, but a classical virus which drove us crazy all over the way. And actually at the beginning of the pandemic, when we have already learned the different clinical manifestation, we have written a paper in autoimmunity reviews alluding to the idea that the COVID-19 situation and the cytokine storm and the different manifestations reminded us actually not only Still syndrome, but also in hemophagocytic syndrome, but also the catastrophic antiphospholipid syndrome. During the months that we are suffering from this pandemic, you can see so many resemblance between the antiphospholipid syndrome and the COVID-19, and especially the tendency for hypercoagulation. So as you can see, we can look now again on the famous scheme. We have genetic, the HLA-DRB1, the PTPN2, but between or among the infectious agents, we should put the COVID, which is actually a virus of autoimmune disease. And by doing the hyperstimulation, causing necrosis, very quick neurosis to cells and exposing different antigen, it hyperstimulates the immune system to generate different autoantibodies and also autoimmune disease. And indeed, when our student Arad Dotan drew this picture and collected all the autoimmune diseases that were reported in the literature, you can see that this autoimmune virus was already implicated in 17 different autoimmune conditions, from vasculitis to Kawasaki, from ITP to APS, from heparin-induced thrombocytopenia to autoimmune hemolytic anemia, but also 18 different autoantibodies. And among these panoply of autoantibodies, I mark those which are associated actually with thrombosis, hypercoagulation, and actually APS. So the virus actually is joining many viruses in the literature that were reported in the past to induce different autoantibodies and different autoimmune diseases. And it is here in this table with a respectful place. So not only autoantibodies are induced, but eventually after a short or longer incubation time, we can see different autoimmune diseases. I would like to draw your attention as only one example to the reactive arthritis that we can see in the different presentation, different articles that were collected here in this place. And you can see also not only the purpura, but also you can see the reactive knee arthritis, in this case of reactive arthritis due to the COVID-19. So as you can see, this is an autoimmune virus. And one of the things that we have learned is that among the main prognostic marker, there are many coagulopathies that can be found, from high titers of or high concentration of D-dimers to the presence of pathogenic autoantibodies, antiphospholipid antibodies. So it's not only APLA, which is induced, but also APS. And this is a 69-year-old patient with COVID-19. You can see he had multiple infarcts, and in the history he had stroke, but the COVID-19 was approved and he required mechanical ventilation. And when laboratory tests were done, D-dimers were increased. He had a low number of platelets and a very prolonged APTT. And if we may actually define him as a triple positive that you can see here. So we believe that we can assume, as they have assumed in the New England Journal of Medicine, that these patients have developed actually antiphospholipid syndrome. So the antiphospholipid antibodies are central to the diagnosis. However, some of these antibodies, which are raised following infectious agents, and especially viral infections, like Professor Cervera has reported in the past, they can actually disappear following the time. But if they remain, they can induce multifocal thrombosis in the future. So the authors of this paper in New England looked for prolonged APTT and also did a study on a large number of patients and found that 91% of them had a positive indication of lupus anticoagulant, the most notorious actually autoantibody in inducing the different coagulation times. So the conclusion was that the presence of lupus anticoagulant is instrumental in this case, just to justify the anticoagulation therapy in those patients who may be found to carry either high D-dimers or one of the autoantibodies against coagulation factor, but specifically the lupus anticoagulant. So this is just the table of the paper from New England Journal of Medicine that indicated the prolonged APTT and also changes in the different factors, especially the factor 12 levels. So again, we would like to say it's genetically determined. Not all patients develop the autoantibody. This is a paper that we have published about immunogenetic factors and predictors of COVID-19. And it's true that it is actually determined by the presentation or overexpression of the ACE2, like in the kidney or in the testis, as was reported. but also the different HLA can determine if you will develop the disease or you will not develop the disease. And this is the incidence of, as you can see, specific genetic markers in various populations, which actually indicates that or explain why we have different infectivity of the COVID-19 in different countries in the world. So now we can add to this that the genetic and the COVID-19 are playing a major part in the hyperstimulation, in the adjuvant reaction, and in the induction of the autoantibodies can be seen here. So in summary, as you can see, some of these studies were done in collaboration of different people in the world, like was indicated in the School of Athens, which appears near the Cappella Sistina in Rome. We can see Plato and Socrates, and we can see even Pythagoras. But needless to say that even though they look like they did not collaborate, they collaborated quite extensively, and therefore they were so successful. I would like to thank all of you for your attention. I believe that the hypercoagulable tendency of the COVID-19 will be more analyzed in our beautiful forum meeting organized by Ludmila Stojanovic, and I would like to wish her and to congratulate her and to have wonderful presentation in this beautiful meeting. Thank you very much for your attention.